I'm Dr. Christy Sutton, author of Genetic Testing, Defining Your Path to a Personalized Health Plan. And I want to talk to you today about the research that's showing that Viagra can be helpful for dementia, Alzheimer's disease, heart disease, and even COVID recovery. And then can natural Viagra do the same things? So we're going to dive into the genes that might put you at a higher risk for having issues for these problems and related to specifically the Viagra part. So let's dive in and let's get started. Natural Viagra for your heart and brain health and to prevent COVID? What? Well, let's see what's going on here. Viagra does more than you think. And the research is really clear that Viagra has been shown to actually decrease the risk for heart disease. So there was some research that was done that saw that men with stable coronary artery disease that took Viagra due to impotence not only seemed to reduce the risk for having a new heart attack, but they actually lived longer. And then they also found that Viagra reduced the risk for Alzheimer's disease and dementia. And there was even a case recently where there was a UK nurse that was in a coma with Viagra, days away from being taken off a ventilator. They gave her this massive dose of Viagra and she woke up. And so if you understand how Viagra works, then you'll know that this is really not that big of a surprise. And we're going to talk about why is this working and what does it mean? And ultimately, the reason is that Viagra increases nitric oxide. So what is nitric oxide? Nitric oxide is this chemical that your body makes that basically dilates your arteries and your capillaries, and it increases blood flow. So it's kind of like turning on all the faucets in your house, and you'll basically, the pressure will go down when you increase the blood flow. So people that have hypertension, they often do really well on things that can increase nitric oxide. It's because nitric oxide increases the blood flow, dilates the capillaries and the arteries. Then these are conditions, these are diseases where you're not getting enough blood flow and there's not enough nitric oxide often. So symptoms of low nitric oxide are erectile dysfunction, low libido, hypertension, inability to adapt to altitude, chronic fatigue, exercise intolerance, poor circulation, atherosclerosis, heart disease, cognitive decline, Alzheimer's disease, clotting, inflammation, anxiety, depression, irritability, and blood sugar issues. And this all comes down to largely not enough blood flow because the endothelial cells of your body are not healthy enough. So hypertension, which is high blood pressure, is the #1 modifiable risk factor for cardiovascular disease. And half of the people that are on blood pressure drugs still have hypertension. So this is a serious problem. And drugs are not treating the cause of the high blood pressure. So if you have high blood pressure because you don't have enough nitric oxide, then your hypertension drug is not going to fix that. Increasing nitric oxide would. So they've also shown that, like they did a study on mice and they took away the nitric oxide gene, and these mice, they became diabetic. So restoring function to nitric oxide can actually improve your glucose uptake and correct vascular dysfunction and diabetes. Truly, if you think about the risk factors for COVID-related deaths, kidney disease, diabetes, which often goes hand in hand with kidney disease, heart disease, obesity, even just you're not getting enough blood supply, you don't have enough nitric oxide. So in our office, we like to test for nitric oxide levels. So you can get these Berkeley test strips online on Amazon or wherever. They're nice because you can do them in the office and they're very user-friendly, and you can measure your nitric oxide. You can measure your nitric oxide levels before exercise, after exercise, because it's going to increase with exercise, hopefully. So we also do a blood test that can tell us more about what your nitric oxide levels are. And so we like to look at it in multiple different ways, because if you don't have enough nitric oxide, you're not going to be healing up well. Your cells are not going to be able to recover because you're not getting enough blood to the cells, and then they can't heal. The lab that we do is called ADMA. So ADMA inhibits nitric oxide. That's one of many labs that we do, markers we look for that go above and beyond the normal cardiovascular, just straight cholesterol labs. And so the decrease in nitric oxide actually starts years before cardiovascular disease and dementia start. And so you'll see that as you get older, your nitric oxide levels decrease naturally. And some more so than others. And there's some genes that are going to decrease your ability to make nitric oxide. And I'm going to talk about those in a little bit. So, but as you get older, your endothelial cells, which are the cells that line the blood vessels, the capillaries, they stop making as much nitric oxide. And then that makes you at a higher risk for plaquing. And truly, the onset of cardiovascular disease cannot be managed, treated, or prevented without first correcting nitric oxide production. And that nitric oxide production is done at the lining of the blood vessels on the capillaries of the endothelial cells. So oxidative stress, inflammation, immune dysfunction, all of these things lead to decreased nitric oxide. And decreased nitric oxide leads to a plethora of disease. One gene that can increase your risk for nitric oxide, and these are in the Genetic Detoxification genetic report that I created. So that Genetic Detoxification report, if you've done 23andMe, then you can create that report to give you like a plethora of extra information. And there's a lot of nitric oxide genes on that report. These are just 3 that I wanted to mention today. So then if you have a risk allele, because you've done that report, then you'll see an increased risk for high blood pressure. If you have the risk allele for this specific gene, the NOS954G. So if you have the A risk allele, you're at a higher risk for low levels of nitric oxide. Specifically, if you have the A risk allele, then you are at an increased risk for cardiovascular disease, cardiac damage, vascular dysfunction, and then if you have the risk allele for the middle one, NOS3, then you're at a higher risk for high blood pressure. And then also the bottom one, NOS3, if you have the risk allele, you're at a higher risk for blood pressure. You'll see that if you have sufficient nitric oxide production, you're going to have more vasodilation. So the blood vessels are going to get bigger. That's going to reduce the pressure, just like turning the faucet on and letting the water come out is going to let the pressure reduce in the pipes. If you have plenty of nitric oxide, you're going to be getting less clotting, less inflammation, and you're going to be having more antioxidants. Antioxidants are key for having adequate levels of nitric oxide. If you don't have enough antioxidants, you're going to have low levels of nitric oxide, and then you're going to end up with more oxidative stress. We see this on labs. We see a high percent of oxidized LDL. So when we do labs, we don't just look at your LDL bad cholesterol. We want to see how much is actually oxidized. Because when you have a lot of oxidized LDL, that's the damaging bad LDL that's going to go out and really cause problems, versus the unoxidized LDL, which is not as bad. So it's important to know what you have. You don't just have LDL, you have different types of LDL. And if you don't have enough nitric oxide, you're going to have more of that bad oxidized LDL. If you have insufficient nitric oxide production, you're going to have more constriction of the blood vessels, and that's going to create more clotting and inflammation, and you're going to have more oxidative stress. One of the most important concepts that I like to talk to about people with is get genetic testing done before you have a disease, and hopefully even before you have the symptoms, because symptoms, whether it shows up as a lab that's out of range, or just, having a hard time breathing, or having a hard time recovering from COVID, the symptoms are much different than having that genetic test to show you that you have an underlying predisposition that is going to increase your risk for having the symptoms, which will once a disease has occurred, like once you have Alzheimer's disease or cardiovascular disease, there is irreversible damage there. But if you start the process decades before to really figure out what your genetic Achilles heel is and fix that problem early on, and do the diet, nutrition, and lifestyle things that can really promote a personalized, precise health plan, then you can prevent the symptoms and the disease from starting. So the sooner you get the genetic testing done and you get with somebody to help you create a personalized health plan, the sooner the better. So how do we increase nitric oxide naturally? So avoid mouthwash. Using mouthwash 2 times daily can increase the risk for diabetes by 65%. And that is because nitric oxide regulates insulin. So without nitric oxide, insulin cannot work properly. So insulin is what helps your body get sugar into the cells. If you don't have enough insulin getting the sugar into the cells, then you're going to have too much insulin. You're going to have too much sugar floating around your blood, around the blood, and that's going to cause diabetes. So if you're using mouthwash, then basically it's going to be decreasing nitric oxide, and that's going to increase your risk for having high levels of blood sugar because the insulin is not working properly. So you still need to get your teeth cleaned, but don't use mouthwash. Healthy sinuses and no obstruction of airflow. So nasal breathing floods the lungs with nitric oxide. When we breathe in through our nose, we're going to be getting lots of nitric oxide production. And if you're exercise, we can see a change in nitric oxide within as little as 10 weeks with 30 minutes 3 times a week. You want to do more than that if possible, but exercise is one of the best ways to naturally increase nitric oxide and then lower the risk factors that are going to decrease nitric oxide. So things that lower nitric oxide that you want to remove from your life: smoking, high blood sugar, obesity, oxidative stress, inflammation, high homocysteine, that's a blood marker that we check regularly, autoimmune type issues, inflammatory type issues. These can all lower nitric oxide. High stress. Try to eliminate and get these issues managed so that you can have naturally higher levels of nitric oxide, and you can then get enough blood going throughout your body to heal up damage, the damage just that is happening every day just from simply living and breathing on Earth. Eat foods that can help your body make more nitric oxide. So celery, lettuce, beets, spinach, arugula, these are going to help your body naturally make more nitric oxide. So lots of antioxidants. Make sure you get plenty of antioxidants. If you don't have enough antioxidants like vitamin C and glutathione and resveratrol, these are some things that are naturally found in our fruits and vegetables. If you don't have enough antioxidants, then you're going to have lower levels of nitric oxide. And lower levels of nitric oxide are going to increase your risk for cardiovascular disease, dementia, the list goes on. So another way to naturally boost your nitric oxide, this NGNOS by Epigenozyme. This is one of many options that we use to help boost nitric oxide and boost blood flow. And then niacin. So niacin is a B vitamin that will actually help your body make more nitric oxide. So have the high lipoprotein A gene. So lipoprotein A is another blood marker that we look for on labs, and it's one of the highest risk factors for cardiovascular disease. If you do the genetic detoxification report, then you will see that this is one of the newer genes that I added. So if you do the genetic detoxification report, then you'll see if you have the gene where you're more likely to have high, then it increases your risk. Natural ways to lower lipoprotein A, and that includes niacin, but it has to be niacin, not niacinamide, which is the non-flush form. So this is the slow release form of niacin, meaning that it's not going to be as likely to cause you to have the kind of niacin flush where you can get kind of red. That niacin flush is nitric oxide being produced. That's actually good for you. You might get itchy, and sometimes even with this slow release, if you're really sensitive, you'll still get that niacin flush and get itchy, and you might think you're having an allergic reaction, but you're not having an allergic reaction. This is a healthy, natural response to niacin. You're getting a boost of nitric oxide. It's opening up the blood vessels, and your blood is getting into areas and cleaning out things it has not been able to clean out and get blood to. And niacin also naturally lowers the lipoprotein A, and it naturally lowers cholesterol. So again, if you want to keep your blood vessels healthy, then it's easier to do that if you don't have high levels of lipoprotein A or high levels of oxidized LDL and a lot of these other markers that we look for. Again, get your genes tested so that you can figure out if you have the gene that's going to increase your risk for lipoprotein A, so that you can figure out what you can do to decrease your risk of cardiovascular disease well before the symptoms start. Because once those symptoms start, the disease has already progressed. So again, this is another great tool that we use. So if you're not getting enough blood to the brain, in addition to the NGNOS, which increases nitric oxide, and the niacin, which increases nitric oxide, Cognitive Complete is one of my favorite for the brain and really getting blood to the brain. And I think this really works synergistically with the other supplements I discussed. So this has herbs that are great for increasing blood to the brain, basically. So somebody like is having memory problems, they're not getting enough blood to the brain. There's vascular dementia where you're not getting enough blood to the brain. There's if you have a concussion, that decreases the amount of blood to your brain. That's part of that brain fog, post-COVID, not getting enough blood to the brain. So this is one of I mentioned glutathione and how you really need to make sure that you have plenty of antioxidants, because if you don't have enough antioxidants, then that's going to naturally reduce your risk. That's going to reduce the amount of nitric oxide that your blood vessels are making. And then you're going to be at a higher risk for having plaquing and cardiovascular disease, which is going to increase your risk for atherosclerosis, heart disease, dementia, Alzheimer's disease, a slew of other issues. So some are topical, some are oral, some are liquid, some are pills. I like all of these and use them with multiple different things, and it's hard to go wrong. But antioxidants, antioxidants, antioxidants to support your cardiovascular and brain health, because that's going to reduce oxidative stress, which is going to increase nitric oxide. So, okay. So this is my book, Genetic Testing, Defining Your Path to a Personalized Health Plan. And it's available at my Genetic Detoxification website, where you can create your personalized genetic report. The personalized genetic report goes along with the genes in this book. The new genes that I added in that report since this book was published are discussed in the report. But this book is very thorough on multiple different genes, way more than what we talked about here. But it does include the nitric oxide genes I discussed, and many other cardiovascular genes and dementia brain genes and immune genes. And so please consider looking at this as a great resource to learn about genetics and epigenetics. So I hope this was helpful for you, and please subscribe if you like the information you learned, and thank you for your time. Have a good day.